name is Candace Evans, and I'm a candidate for the Masters of Public Health and Nutrition program at Liberty University. Over the course of the semester, expanding from August to December, I had the pleasure of completing my practicum at the Southeast Georgia Health System located within my community of Brunswick, Georgia. Therefore, in order to learn how the hospital fulfills their mission, I decided to do my practicum in the Department of Infection Prevention, in which I was listed as an observer. Under my preceptor, Ms. Lynn Reynolds, I was able to learn about what precautions were taken to protect the patients while they received treatment. During my practicum, I learned what to look for when conducting environmental inspections, hand hygiene compliance, and catheter compliance. In addition, I had the privilege to sit on a multitude of boards, which included the Moves Committee, Quality Assurance, and Nursing Leadership. I also participated in a multitude of activities ranging from assisting in providing education to community workers to assisting in providing education to new hires. In addition, I was able to attend a multitude of symposia ranging from multi-drug resistant organisms to team building exercises. Furthermore, I was able to participate in Quality Week, in which I created a trifold display board on the game of Risk for my practicum project, which was limiting the risk of catheter-associated urinary tract infections, also known as CAUTIs. Even though the board did not win first place for creativity, it did win second place for improving patient safety and quality of care. Lastly, I was able to learn how to conduct surveillance on hospital admissions, isolation codes, and positive lab reports. From my experience, I learned the importance of conducting daily surveillance because this is the most proactive method to ensure that the patients that need to be isolated are isolated. In addition, this was the best way to identify hospital-acquired infections. It is important to catch HAIs when they occur so that it can be recorded into the National Healthcare Safety Network, because all infections for that quarter must be reported by the end of the next quarter. While at my practicum, I also learned how to identify, classify, and place healthcare associated infections and patients that present with multi-drug resistant organisms into the National Healthcare Safety Network. Please move forward to the next slide. However, for time, I will now focus on my research project, which was on the usage of Foley catheters within our main hospital. Once a month for my project, I had to conduct monthly point privilege checks on all the Foley catheters to ensure that usage was appropriate and the maintenance bundles was in compliance. The next slide depicts the life cycle of the Foley catheter. This conceptual model illustrates the 4 stages of the urinary catheter life cycle as targets for interventions to decrease catheter use and CAUTIs. Each area on this cycle was monitored for compliance during my project. Overall, from these checks, the medical documentation was thorough in compliance. However, the maintenance bundle was not always in compliance, especially when it came to the independent loop. When the independent loop was not present, it was our duty to first locate the nurse that was responsible for that patient's care, and then to ask the question to the nurse of why the loop was not present to gain understanding of what we can do to better that situation. Therefore, the purpose of my practicum is to reduce the effect of HAIs by targeting the usage of Foley catheters. Foley CAUTIs are the most prevalent and reportable infections in the National Healthcare Safety Network. At any given time, 15 to 25% of all patients whom are hospitalized will receive a catheter. Of that 15 to 25%, 75% of those patients will contract a UTI during the course of treatment. Therefore, in order to reduce CAUTIs, there were certain areas in which I had to target. Please move forward to the next slide. first area targeted was catheter placement. Through the usage of the electronic health record and addition of the urinary catheter insertion bundle assessment, I was able to conduct surveillance or sterilization of the procedure, in which the nurse present completes and places the information into the patient's electronic health record. As you can see, the series of questions the nurse had to check off on. Overall, there was 100% compliance for this section of the patient's electronic health record. Please proceed to the next slide. The next area I conducted surveillance on was catheter care. In this area, I looked for compliance with the Foley catheter maintenance bundle. At this time, my preceptor had just updated the genitourinary assessment in the patient's electronic health record to include a urinary catheter care and maintenance bundle assessment. This assessment was also in the form of boxes to be checked off by the nurse during their shift. This assessment served more as a reminder to the nurse of best evidence-based practices to be followed. On the next slide is the protocol for catheter removal. With the multidisciplinary team composed of infection prevention, quality assurance, and nursing leadership, we were able to create a protocol to signify when a nurse should disconnect a Foley catheter. When the nurse checks the box that reads "does not meet criteria," a disconnect order will appear on the nurse's to-do list for that patient. However, the nurse did not always honestly check the correct box to have the disconnect order sent. Instead, they would choose the immobility due to physical constraints or unable to move, which was not always the case. Please move forward to the next slide. This slide depicts the results of compliance with the Foley catheter maintenance bundle. The yellow and red areas display areas that need to be improved. The overall goal for the Foley catheter maintenance bundles is to have a 95% compliance across the board. The strategy for decreasing infections focused on the appropriate uses of catheters and the compliance of Foley catheter maintenance bundles. A multidisciplinary team was formed to enhance the bundle information on the patient's electronic health record by requiring documentation and assessment of the Foley catheter maintenance bundle to be completed every shift. In addition, monthly point privilege checks on the bundle were conducted, and an education symposium was conducted to provide nurses with vital feedback. Please move forward to the next slide. The overall compliance for the Foley catheter maintenance bundle was 90%. In addition, there was a 40% decrease in CAUDIs between the second and third quarter. This may be due to the decreased amount of recatheterizations and a decreased amount of excessive extended catheter usage days. Increased compliance to the Foley catheter maintenance bundle, along with nurse-driven protocol, contributed to decrease in the number of CAUDIs. The downfall in the study is that the nursing staff often did not feel empowered to disconnect a Foley without a physician's approval. Therefore, the nurses needed more encouragement in taking ownership of their patients' care by understanding the crucial role they play in patient safety initiatives. Therefore, I do believe my project was a success because I was able to see a decline in the number of CAUDIs, and all my objectives were met. However, I did realize that educating nurses on the importance of reducing CAUDIs is not sufficient enough, because even though they all agree that it's important to reduce CAUDIs, they often lack the confidence to disconnect a Foley catheter when no longer necessary without a physician order. Therefore, if I was to do anything different in my practicum, I would focus more on team building and confidence building activities for nurses. In these exercises, I would add activities and or scenarios of what happens when a nurse does not follow their instinct and disconnect a Foley catheter within a timely manner. In addition, I will also put more emphasis on the utilization of condom catheters for males who are competent and mobile enough to utilize the instrument. Thank you for your time.